My topic is very critical. The thing is, challenges. See, like I told you, in the grassroots level in a hospital, if a nurse does not know how to do a research, okay, what skill do you need to do a research? Anybody can tell? What is the most important skill a nurse needs to have to do a research? Critical thinking, decision making, okay? All these are certain things a nurse needs to have skill, okay? Thinking of what can be done, what is the lacunae in the place of her work, how can she improve certain things. Like I told in the beginning, many of the things were invented by nurses, like the crash cart, because the whole emergency was crowded, okay? It was the nurse's idea basically to invent a crash cart, okay? But is that credited in the hospital? Nobody even tells. This I went through a lot of books and found out that the nurse invented the crash cart in the hospital wards and all. Many things are invented by the nurse. Hats off to the nurses. Are we the same thing even today? How many researches are done in the education side? How many innovations are done in the education side is a big question. Okay, where is our creativity skill? Where is our innovation? All these things are certain thoughts you will have to ponder upon. Okay, so many of you are students right now. So think about all that. See, the future is only in your hands. How you develop, how you grow in your own field. You have joined the nursing profession, you need to grow in your own field so that you get recognition from people. That is very, 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 very important. Okay, so we will go on to the presentation. Don't worry, I'll just take half an hour so that we'll complete early and you can all also leave early. So a few objectives I put for my presentation. Don't get scared looking at the objectives. Scope of AI. Understand AI data analysis in nursing. Discuss AI for clinical decision support. Describe AI in nursing education and training. Enumerate ethical consideration, bias and fairness. Understand challenges, data availability and interoperability. And understand the skill gap. So, scope of AI. When you look into the statistics, you can see that around 50 million US dollars are spent only on artificial intelligence, especially in the research area. So the world is really moving into artificial intelligence, and we all know that artificial intelligence can be beneficial and it can be harmful for anybody, okay? You have seen of a lot of robberies going on using artificial intelligence, like talking like a girl, talking like the daughter of the parents, and so many things are happening. Okay, so we should be thankful that we can use the artificial intelligence in research in the right way, not in the wrong way. And you need the, one of the disadvantages also are coming, you need the mindset to learn. That is very, very important. Many of us, as age goes, we try to resist in learning new things. Okay, but it is very important to update yourself in the area of working. You need to update your knowledge. So artificial intelligence is transforming healthcare in the market since 2024. Like I told you, around 50,000 billion dollars are used only for artificial intelligence in the industries and in the healthcare. Nursing research stands at the forefront of this innovation wave, and however ethical and practical challenges remain to be addressed. One of the main disadvantages or main challenges is nurses resisting to learn artificial intelligence. So AI driven data analysis, there are two main things. One is the large data set analysis. There are huge amount of data, and electronic health records, wearables and sensors provide vast data, okay? For example, you can see your own mobile is an artificial intelligence. Sometimes the Apple phone especially, okay, you may be keeping it may be I mean, it may not be in a switched off mode, but it is on. So sometimes when you talk about dresses or sometimes talk about different ways or handbags, what happens is your phone is listening to you. Okay, what is your phone doing? Your mobile is listening word by word to what you're talking. So next, what happens when you open your mobile? You want to see some cooking in it, but automatically where does it go? It goes to your dresses. Okay, it's listening to what you're talking and giving you all the different types of dresses or whatever you're talking about. It automatically comes as a app and starts showing different dresses and bags and other things. Okay, so AI is all around us. AI is listening to what we are doing. AI is, like I already told you, useful as well as it is dangerous as well. Okay, there are incidences where what happened? People have robbed houses. How do they rob houses? They find out through Facebook, social media and other things, people updating all the details. Okay, and then finally what happened? They go steal from that particular house. So AI can be useful. AI can also be harmful for people. So lot of, like I told you, wearable devices. So you have vast data which are there in the web. Okay, you can do lot of data. Even if you're working in a hospital as a staff nurse, a simple procedure like hand wash can be captured well. Okay, a simple procedure like hand wash can be captured well. So this huge data can be converted into research and published. Okay, there are opportunities in front of you. It is how we take that opportunities forward and do well. The second important thing is related to predictive modeling. We have seen many of them talking about the predictive modeling. What is predictive modeling? For example, the previous speaker Jayabati was talking about breast cancer. Okay, in 10 years, the person will automatically know that she is at high risk of getting a breast cancer, or the locality where you're living. Okay, maybe it is a polluted area. So the AI can automatically sense and say what type of cancer you can get. Okay, so these sort of things are predictive modeling. So all predict patient outcome, aiding early detection of decline, sepsis prediction 6 hours earlier with 92% accuracy, personalized intervention based on real-time data. So these are all different types of examples of predictive modeling. Like in a few months or few years, AI can automatically predict what type of diseases an area can get, what type of illnesses a person can get. Okay, there was one story which was told by a person. It was there in the newspaper also. One child was brought to the doctor. The child had lot of fits. Okay, fits repeated and so the doctor took that child in the hand and was trying to ask the history of the patient. Okay, then simultaneously he told his junior, just find out where the address of the particular child is and where they are living. So the mother was trying to narrate where the address was. Then this child was continuously convulsing and they gave some anticonvulsant. And then what happened is, after nearly 1 hour, the child died in the hands of the doctor. So he was narrating this story, telling that when they found the address of the child, this child, they are staying in an area where lead is high. Okay, the parents are all making lead equipments. Okay, working in lead companies and producing, helping in preparing lead. So these dust of the lead, okay, was the main cause for conversions for this little child. Okay, so this was explained to the child. So you can see how, suppose there was AI in that particular area, okay, they could have prevented the death of that particular child. So the child died and they tried to find out how many children can be affected in that particular area with lead poisoning and convulsion. So this was one story told by a doctor where he said it could have been prevented because the government has most of the statistics of different areas. So it can be done, it comes under the predictive modeling where health can be taken care of when children fall sick. So the next one is AI for clinical decision support, evidence-based practice. We already heard a lot about evidence-based practice. AI tools assist nurses with research-backed decision. The previous speaker and the other speakers also were talking about different types of systematic review. Okay, and lot of reviews which are there, which can help in proper decision making. The next one is reduce cognitive load. AI minimizes errors and mental strain. This is one side, it is good. You do not have to have bytes of papers and collecting all the data and doing the analysis. So these can reduce certain errors and mental strain when you do a particular research. That's what it becomes very useful for people doing research, and like I already told you, it has its own effect as well. People take even AI for granted also, okay? The third one is medication optimization. Algorithm reduces medication errors by 15%, enhancing safety. There was a nice video on WhatsApp where I saw China. In China, what is happening is everything is done by robots only. Okay, from collecting the prescription and the small boxes. I wish I would have got that video. The small boxes go to straight to the pharmacy, either the OP or the IP. After that, the medicines are collected by the robot itself. Okay, it's all robotic trained, and the robotic takes all the medications and then goes and dispenses near the bedside itself. Okay, there are big holograms like built near the bedside, and it's getting dispensed near the bedside itself. Okay, so China has gone far higher than us, where medication errors can be reduced accurately. So you have very less medication errors, and you can overcome those things when you have an AI. Still, India is very far away from such technologies. Support clinical judgment, enhances patient safety and quality care delivery. So every hospital, we think about only patient safety guidelines. So it is very important that each person needs to support the clinical decision using an artificial intelligence. So the next one, we will go on to AI in nursing education and training. I think from the beginning, many of the speakers had concentrated on this particular part. Virtual simulations, immersive learning to practical clinical scenario safety. Most of the time, we think about different types of virtual realities. Second one, we talk about future ready nurses, preparing graduates for AI integrated healthcare roles. All this is mostly integrated in the modules in the Western countries. In India, it still needs to be integrated into the curriculum. Okay, so every time, just now in 2022, there was a complete revision of our syllabus. Lot of new things were added into our syllabus. So this again has to be integrated into the syllabus before it comes to the students. Okay, so next is personalized learning, adapted content based on learner progress and needs, and all AI tutors boost students' success rates by providing tailored feedback. One example is the NCLEX exam. Pass rates improved by 10% with AI support. So basically, students are the benefiters when they get a one-to-one mentoring, and of course, most of these modules are what? Self-paced. Whenever they have time, they can complete that particular modules, and you get your corrections, and then you can again continue. But again, it has got a time period. Within that stipulated period of time, you will have to complete that particular modules, whatever is given to you all. So again, it again depends upon the takers of this particular modules. Like who takes it, do they have interest in completing these modules, and then how to utilize these modules. So in short, AI education and training, you can see virtual simulations, future ready nurses, personalized learning and AI tutors. Okay. The next one is ethical consideration, bias and fairness. Algorithm, that is AI systems may underperform for minorities due to bias. Okay, sometimes the AI is not a human being, basically. You should all know that it cannot complement or it cannot replace a human being. Okay, that's why they say that it can replace any profession but the nurses and doctors in the healthcare field. It cannot give doesn't give a emotional touch. Many of the times in WhatsApp and certain short clippings we can see robots going and giving feeds to the patient, giving breakfast or food to the patients. Okay, but they can only give and stand and then help them to wash their hand, and then it comes out of the room and goes back to the nurse's station. But it cannot be replaced by the psychological support which is given by a nurse. The caring, okay, the conversation, the emotional component of it can be only rendered by a nurse beside the patient. So fairness and equity must ensure AI treats all patients fairly and equally. Like I told you, it is not a human being, it is a machine. So we do not know. Privacy and security, protect patient data with robust safeguards and transparency. What type of patients need privacy and security? Anybody? What type of patients need privacy and security in data? Sleeping, listening. What type of patients need privacy and security? Patients like psychiatric, excellent. Then like vulnerable patients, HIV patients, patients who have undergone NTP. Okay, all these patients you need data, safety and security, and we cannot 100% see or get the assurance that AI can keep them safely unless it is made to do that. Accountability, clear responsibility for AI decision making is essential. So again, decision making using an AI is again a question. Sometimes every decision cannot be taken by artificial intelligence. It needs a team of people to do a decision. See, certain decisions can be done superficially by the AI, but not all the decisions. Okay, next we go on to the challenges, data availability and interoperability, non-standard data. This mainly I can tell in nursing, you have all these challenges. Data formats vary widely across organization. One hospital is different from another hospital. One nurse perceives certain words differently than another nurse in another hospital. So you can see lot of data which are not standardized. So that becomes a big challenge when you collect certain data. If there is uniformity throughout all the healthcare organization, then you will have factual and real data. Sometimes if there is no standard format, there can be a problem. Next one is data silos. Information trapped in disparate system reduces utility. So huge chunks of data which are stored and which cannot be utilized also can be a big problem. We all know that sometimes data gets corrupt. Sometimes the systems may hang. Okay, lot of clinical, system glitches are there. Okay, we do not know which data is put in which format. So plenty of things. That's why unless you have the interest to know all this or understand this particular concept, it's very difficult for us to coordinate and do a particular research. The last one is data quality, okay, which is very important. 60% of nursing data remains unstructured and hard to use. Okay, very important. Sometimes if it is a qualitative data or data which does not have structured tools, it is very difficult for AI to capture all the data. Okay, which is an existing problem in most of the healthcare delivery systems. Governance needed. Standard framework for data sharing must be implemented. Like I told you again and again, standard operating procedures or manuals where throughout the organization or throughout the state, they have certain small details to be captured. See, the more data is captured in standard format, you can do lots of research. Okay, if there is very subjective data which you have, you cannot do anything with it. Like I told you, each person's perception is different from another person. So AI, you need a lot of things to work on and integrate the data into the system. See, AI is how we utilize it. Okay, now you will get the outcome. It is not coming from anywhere. We are preparing the tools. We are feeding it into the system. So we need to derive what objectives we are planning to operate with that particular system. Okay. The last one is addressing the skill gaps. So what are the main skill gaps in learning artificial intelligence and in research? So you can see is AI literacy. That's why I told you nurses require training to effectively use AI tools. From the morning you have seen lot of speakers talking about different types of artificial intelligence tools. Okay, how many of you are familiar with these tools? PhD scholars, UGs, how many of you are familiar? Raise your hands. Okay, quite a number, good. Okay, so this conference should really help you to transform. See, like Dr. Maliga said, any help you all want, please approach us. There are a lot of oceans of tools, especially research. Okay, research tools are there where you can do miracles in those tools. Alright, small things also you can capture and complete. Okay, so it is all based on our interest alone. The second one is, first one is that's what training of nurses in AI. Second one is collaboration. Even now the other speaker is talking about collaboration, that is cooperation between nurses and AI experts is vital. Okay, most of the time in our work setting itself, you will see that number one is computer operator பண்ணுவாங்க. Okay, then when you look at the output, it is completely different. Okay, we need to see that it is customized according to our needs. Okay, we need to see that it is customized according to our hand washing steps. Okay, it is not anything they can put into the system. Adha na solra, whatever input is there, adhe input the output varum. Okay, so you have to sit with the computer operators or technicians and see that what we need or what data, what is your objective, you have to see it word by word. It is not very easy. Okay, and then after that you cannot use it immediately. Next enna pannom? Next a trial run. Okay, to see if it is capturing what it is supposed to capture. Is it clear? All are sleeping or want to go immediately? Okay, so a trial run needs to be done in few samples to see that whatever you customize is working well. And then you can go for the actual data. Otherwise what will happen? It will become a complete confusion and chaos. The third one is curriculum integration. Curriculum integration is AI concept must be embedded in nursing education. So concepts, most of the time you can see college side people like to learn about artificial intelligence and upgrade their knowledge. Staff nurse side or in the hospital side, very few people have the interest of learning things. Okay, so it is very important that everybody, all the nurses in the hospital as well as the college needs to update themselves with all sorts of tools and other things. Just take 1 hour for yourself. Okay, your personal and professional development time. இன்னைக்கு போய் பாருங்க என்னென்ன கத்து கொடுத்தாங்க. I do not know if you have taken notes. Zotero enna click on the app. See, everything is in your hand. Okay, book எல்லாம் தந்து திருப்ப தேவையில்ல. இல்லனா போய் system open பண்ண தேவையில்ல. It is all in your hands. User friendly, correct? Yes or no? So whatever you want, you can automatically learn. 5 நிமிஷம் இருந்தா கூட don't go to YouTube or short film clips or TV. See, lot of things comes in your apps. சரியா நிறைய விஷயம் வரும். Okay, that's what. Your mobile is always listening to you 24 hours. Okay, கதை பேசணும்னா if you are talking about some serial, automatically ரெண்டு serial photos வரும். You will go off to that. Okay, so it depends upon how we use our mobiles. Okay, so put all these words in the YouTube, I mean in the Google, and search and find out இதெல்லாம் கத்து கொடுத்திருக்காங்க இன்னைக்கு. How will it be useful for my research? How will it be useful for my future? சரியா இதெல்லாம் வந்து like I told you, it is personal interest and professional development. யாரும் வந்து உங்களை force பண்ண மாட்டாங்க. Okay, the more you learn about it, next what will happen? People will start recognizing you. Okay, இந்த staffக்கு நல்ல விஷயம் தெரியுது. She is doing a lot of research. That staff is doing better. Okay, they will start recognizing what you are doing. Okay, so that is very important. The last one is current gap. 70% of the nurses feel unprepared for AI use in practice. இது 100% உண்மை. 70%, like I told you in the beginning itself, nurses வந்து mostly multitasking. Okay, it is a profession which is very comfortable. காலையில 8 o'clock போயிட்டு 3 மணிக்கு வந்துட்டு தூங்கிட்டு பசங்களை பார்க்குற profession. Okay, other than that, now only it started developing. Okay, people are aware. இவ்வளோ விஷயம் நடக்குது, we have to do research, we have to complete PhD. Okay, once upon a time nobody was bothered about MSc or PhD. Now people are gushing into doing PG கம்மி ஆயிடுச்சு. PhDs, everybody wants to finish PhD. Okay, so of course it is a plus point for people to complete PhD, and hospital people also to get themselves upgraded. But in the same way, you can see lot of people, especially in the hospital side, 20 years work on the staff nurse, 25 years work on the staff nurse, they resist to learn. They resist even to learn to operate a computer in the hospital. Okay, நிறைய hospital எனக்கு தெரிஞ்சு they are not switching over from paper to system to electronic health records because many of them do not want to learn or resist. But just imagine artificial intelligence. Okay, so it is very important that nurses need to get upgraded, need to have interest. Okay, சில பேர் சொல்வாங்க இன்னும் கொஞ்சம் வருஷம் தான் இருக்கு ரிட்டையர்மெண்ட்டுக்கு, நான் ஏன் படிக்கணும், first thing. Okay, so these sort of things should go out of the mind. Okay, nurses should show our enthusiasm or eagerness to study. Okay, which is very important, and automatically don't think it's going to be a waste. The more you study, people will automatically recognize you. Okay, nowadays you can see lot of promotions and other things are based on your credentials. எவ்வளோ பண்ணியிருக்கீங்க ரிசர்ச், என்னென்ன பண்ணியிருக்கீங்க, பேட்டன்ட் பப்ளிஷ் பண்ணியிருக்கீங்களா, காப்பிரைட், அதெல்லாம் நர்சஸ்ல ரொம்ப கம்மியாக இருக்குது. Okay, so go into collaborative research, find out other people from other universities and try to do research. எல்லாமே உங்க இன்ட்ரெஸ்ட் தான். Okay, if you feel that I am happy with writing some articles and getting published, it will not suffice. Writing a book, get 2-3 people from other organizations and together write a book. Even I have not written a book. It is, of course, I am also a nurse. So get people like that. Okay, few people from other places, other institutions, plan and start writing a book. Okay, these are things which nurses do not indulge in. Okay, it is daring decisions you have to do. There are people, publishers who will handhold you in doing it. Okay, framework கொடுக்க சொல்வாங்க, photos வரைஞ்சி கொடுப்பாங்க. There are people. So segregate 1 or 2 hours for your personal and professional lives. Okay, because you are all young now. Okay, முடிக்கிற ஸ்டேஜ்ல இருக்கீங்க. Some of you are already PhD scholars. Some of you may be PG students. Okay, from now itself, see that you try to grow up the ladder because it's not going to stop over here. Okay, AI is not going to stop at all. It will go on and on and on and on. Okay, you 100% have to get updated in your knowledge. Okay, so Okay, so I think conclusion. AI is the need of the hour. Nevertheless, the usage and extended outputs of the AI in research is overwhelming. 100% it is overwhelming. இப்போ மல்லிகா மேம், விஜி எல்லாரும் பேசினாங்க. Certain things would have gone above your head. சரியா, எது கிளிக் பண்ணது, என்ன வரும், என்ன எழுதணும், even Melvin when we are talking about different things. Okay, it is all a query for us. Okay, it may be overwhelming and need to learn from. You have to update yourself. There's no other go because we are in the AI generation now. Okay, it is hard and fast on your self to see that you learn everything related to AI. Search பண்ணுங்க, different things search பண்ணுங்க, because I see most of India is a country which is the main strength of our nation is what? The youth. 60% of our nation's population is only youth. Okay, age of 35 years. Alright, the most productive age. Okay, so what are we all doing? See that you learn, you develop, you come up in life. It is mandatory now. You cannot tell that I'm not going to learn AI. AI is useful in all the discipline, education, especially doing research. Like I told you, learn AI in such a way that it helps you to go up the ladder. Writing a paper, publishing a paper, copyright, patent, so many things people are talking about. So try to develop in all these areas. It is only based upon your interest and your interest alone. So thank you for your patient listening. Thank you so much. Thank you for your patient listening. And if you have any doubts or clarification, you can ask, otherwise we wind up. Thank you very much.